Have you ever awakened in the middle of the night and thought to yourself, why does a disc injury that pinches a nerve cause tingling, burning, pain, and numbness? Or am I the only weird one out there that wakes up with questions like this? Well, if you're like me and weird and wonder why a pinched nerve causes that down an arm or a leg, watch this video because I've got the answer for you. Hi, I'm Dr. Jeff of Never Look Back Pain and the Midwest Disc Clinic here in Northeast Indiana. Welcome to my channel, Never Look Back Pain, because when we finally get people out of back pain as a result of a neck or low back disc injury, praise God, they never look back. Today, I want to share with you an interesting fact. Something quite interesting. Why, when you have a pinched nerve due to a spinal disc injury, do you have tingling, burning, pain, and finally numbness? And there's a very specific reason for that. So let's go into it. I'm going to make it super simple and super easy for you to understand. If you have this tingling, burning, pain, and numbness, and you can't sleep at night, and it's going down an arm or leg, why is that happening? And here is why. A spinal disc herniation will put 7 pounds of pressure on a small little tiny nerve. And what that does is that cuts off the oxygen supply or blood supply that carries the oxygen to the nerve that goes from your neck down to your fingers or your low back down to your big toe. When you cut off oxygen, it's like holding your breath. I'm not suggesting you do that. I'm saying if you were to hold your breath, you would pass out, and if you couldn't breathe, you'd ultimately die. And that's exactly what happens to the nerves. They lose oxygen, and as they lose oxygen, some pretty interesting things happen to create these symptoms. So let's give you a little bit of anatomy, very simple. A nerve cell simply is made up of a head, like my fingers. Look at my hand here. My fingers, this part, the head, called the dendrite. And then this part of my arm is the tail, called the axon. So a nerve cell is made up of this dendrite, looks like this, and this tail called an axon. And there are millions of these little cells that make up a nerve. So it would look like this. The end part of this axon is this fist here, okay, called the synaptic end or bulb. And then there's a space between the end of the axon or the tail. There's a space like this where the next dendrite is. And a nerve impulse is like a piece of electricity that runs down the axon. And then there is a bit of chemicals that get released into this space between the bulb or the end of the axon and this dendrite head. There's a cliff. You have to jump the cliff to get the impulse to this part of the next nerve cell called the dendrite, and then the same thing happens, and this leapfrog happens from end of axon to the next dendrite. There's a space that the nerve impulse has to jump, and so it is electrical impulse force, then chemical, jumps the gap, hits the next dendrite or head, and then goes down the axon, and then it leapfrogs. Now what happens is this. In a normal cell, normal healthy nerve cells or nerve, this is happening milliseconds, bang, 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 going all the way from neck to fingers, low back to toes, bang, 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 nothing impedes it, nothing stops it. Yet, when you have a disc herniation and you have pressure on that nerve, you cut off the oxygen supply. Well, the body is incredibly intelligent. God designed this incredibly intelligent thing. So if we have less oxygen, the nerve cells start to shrink. So from dendrite to end of axon is no longer this length. It shrinks in size because we don't get enough oxygen. So it says, if we don't have enough oxygen, we're going to shrink in size so we can just have the right amount of oxygen. So what happens is, as this cell shrinks and this cell shrinks, it pulls apart. And the space between the end of the axon on one nerve cell and the dendrite or head starts to get wider and wider. And as it gets wider and wider, it's harder for the nerve impulse to leapfrog to the next dendrite. And the fluid that's in the space that is conductive or allows electricity to jump starts to lose minerals. As you lose oxygen, they pull apart. You get bigger spaces, smaller nerves, and this space gets bigger, it becomes harder to jump, and the nutrients that allows the electricity to go through becomes less, and now it is impossible for that nerve to jump as much. And then we have levels of different types of feeling that you'll feel. The first is tingling. From time to time, I have tingling down my arms and my legs. That means it's starting to pull apart. The next phase would be burning. Well, now I've got this burning down my arm or burning down my leg, and that means it's pulling apart even further. Okay, so the next phase would be pain. We're pulled away even further, and now I've got pain down my arm, pain down my leg, and the last phase of nerve dying is called numbness, when it's so far apart that almost no impulses are jumping at all. Now you experience numbness in your brain and down the limb. So that is why you experience what you experience, and in our clinic we have multiple ways of helping this heal. We take the pressure off the nerve and the disc non-surgically, and then we allow this to start to come back together as best as we possibly can, helping a patient get rid of tingling, burning, pain, and finally numbness. I'm Dr. Jeff. I hope you enjoyed this simple piece of information. I'm also the author of this little book, Never Look Back, Never Look Back Pain, a simple guide to the cause and care for neck and low back pain. Why did I write this? Because there are so many people every single day that come to my practice after years of suffering, and they don't know why they have the pain still. They don't know what's causing it. They've had surgery, they've had pills, they've had shots, they've had physical therapy, and still no proper diagnosis. We teach you what a healthy spine should look and feel like. We teach you what a sick spine, how that occurs. We teach you the tests that your doctor should be running. Whether you have insurance or not, it doesn't matter. If they're not running these tests, get rid of them, find a new one. We also talk about a simple way where you can wind up getting your disc healthy naturally, as well as some simple tips on how to prevent injury to your neck and low back. Again, you can go to neverlookbackpain.com and grab my book. It'll be the best investment of 20 some odd dollars you ever spent. Could save you thousands. I'm Dr. Jeff of the Midwest Disc Clinic and Never Look Back Pain. Once we help you get out of back pain due to a spinal disc injury, praise God, you never want to look back, and we help people live their life. I'm Dr. Jeff. Have a fantastic day.